Good afternoon. Today's briefing may be a few minutes shorter than normal, as I do have a call with the police services and EMO to discuss enforcement related to COVID-19. Across Canada, there have been over 8,500 cases of COVID-19 and 96 deaths. We're certainly watching the large number of cases in the United States. There are no new cases to announce of COVID-19 in Prince Edward Island, so our numbers remain at 21. We now have a total of 3 of our cases who are considered recovered. For interest, 48% of our cases are female, and 62% of the cases are in Queens County and 28% in Prince County. We've performed 870 tests to date, and 665 have come back negative. All of our cases, as we've discussed previously, are out-of-country travel related. And again, for interest, the most common symptoms of the cases here in Prince Edward Island, and similar to symptoms of the cases across the country, presenting symptoms are cough, chills, and headache. Although we don't have any new cases to announce, this is not a time to slow down or become complacent. It's actually when we need to keep going with our messages and our actions around physical distancing and self-isolating if you have returned from out of province or out of country. And I say it, I know, on a regular basis. If you're self-isolating following travel, that does not mean going out to the stores, going to the bank. You stay on your property. But those islanders who are not self-isolating, they should be at home as much as possible. And if you're going out for necessities, then practice physical distancing. And anyone who is experiencing symptoms of COVID-19, regardless of travel history, either call 811 for a referral to one of our cough and fever clinics to get assessed and tested if necessary, or you can be referred by your family doctor or nurse practitioner as well. As a follow-up to yesterday, there is a video posted online of how to wash your groceries when you get home, and I think we had a number of questions following the media briefing on that yesterday. I want to make sure people are aware that no new construction permits are being issued at this time. And we continue to get concerns related to the construction industry. And certainly if construction sites are operating and can be delayed or postponed in terms of finishing, they should stop work. But any emergency construction repairs should continue. I want to be clear that if you are on self-isolation following travel, you should not be visiting banks. Anyone else visiting banks should really be doing only essential transactions. And I want to thank the banks for the measures they have put in place to protect the clients and pay attention to the physical distancing requirements that they have put measures in place to do so. I'd like to thank, and I know Marion has done this regularly as well, all our essential workers who are working through these uncertain times for all of us. And this includes our healthcare workers, our first responders, our law enforcement, grocery store clerks, truck drivers, postal services, and the list goes on. Some of you may be aware that we saw this kind and supportive spirit of Islanders, where this morning there was a parade, really with law enforcement and fire, I believe, showing solidarity for our frontline workers. And certainly as a healthcare provider, this means a lot to me and our other healthcare colleagues across the province. And during these challenging times like this, these acts of kindness mean so much. And on that note, I heard this morning a song that had been written by Tara McLean and Catherine McClellan, two island artists well known to many of you. And they recently wrote and recorded a song about what we're going through right here. And when I heard the lyrics, I think they meant a lot for me today, and I think they're relevant for all of us. I know it will be all right. It is going to take some time. So hold on through this storm, and soon we will be together. And I feel that way as we go into this storm, that we will get through this, and but we're in for some rough days ahead. So I like to finish with that. Je fais en français en premier. Les chiffres continuent à augmenter. Maintenant, il y a plus de 8500 cas de COVID-19 et maintenant 96 morts au Canada. La bonne nouvelle aujourd'hui pour l'île, c'est qu'il n'y a pas de nouveaux cas. Nous sommes toujours à 21 cas. Je confirme qu'il y a 665 tests réalisés qui sont négatifs et les cas positifs sont reliés au voyage hors du pays. Ne vous trompez pas que les choses commencent à ralentir. C'est justement le temps de continuer ce que nous faisons. Après tout voyage, vous devez vous isoler et vous devez rester chez vous, dans votre cour, sur votre terrain. Si vous n'êtes pas en isolement, vous devriez rester chez vous autant que possible. Sortez pour les courses essentielles et respectez la distance physique. Juste quelque chose à mentionner, les permis de construction ne sont émis en ce moment. Et c'est vraiment les travaux d'urgence qui sont nécessaires devraient toujours continuer par contre. Et pour les banques, si vous êtes en isolement, n'allez pas à la banque. Et si vous êtes à la banque, c'est pour des transactions essentielles. Et merci aux banques pour les mesures de sécurité que vous avez prises pour vos clients, comme la consigne de la distance physique. Et un grand merci aux travailleurs essentiels qui continuent à faire ce qu'il y a à faire durant cette période d'incertitude. C'est vous autres, les travailleurs de santé, les premiers intervenants, les représentants de la loi, le personnel au supermarché, les camionneurs, les services de courrier et beaucoup d'autres que je n'ai pas nommés. La sécurité de ces gens est en partie notre responsabilité. Continuons à faire notre part et restons chez nous. C'est la meilleure façon de les reconnaître. Merci.
Thank you, Dr. Morrison. Health P.E.I. continues in our joint response with the Chief Public Health Office with our increased testing and screening of individuals, and as well as our preparedness for an expected increase in cases of COVID-19 and hospitalizations. The staff at our Prince County Hospital, Queen Elizabeth Hospital, and all facilities are working to move patients to locations where they can be cared for appropriately and safely. This is creating space for patients who may need hospital care at the QEH and PCH for the surge in patients that we are expecting. In our initial plan around this is to have patients who require hospitalization with COVID-19 being admitted to the QEH, and further bed management plans are developed and will be implemented if necessary. Another piece of our response in this shifting of our services is around psychiatric care. And today, Health P.E.I. has opened a psychiatric urgent care clinic located at Hillsborough Hospital. This clinic will see patients who need urgent psychiatric care but do not require the medical care of an emergency department. Patients will be redirected to this urgent care clinic. And we're starting with this service in Charlottetown as an important step in both helping maintain capacity for our emergency departments while also providing care and keeping some of our most vulnerable patients safe. As Dr. Morrison has said, everything we do now as a province to social distance, self-isolate when needed, and follow the Public Health Office's advice closely will help ensure our island health services are able to continue to provide the quality care that islanders need. Personal protective equipment is in low supply globally. Countries that have been hurt in this pandemic harder than us are ordering as much as they can, and we're competing to get the supplies we need. Our logistics team has done an excellent job of sourcing personal protective equipment, and so far we have been able to maintain the supplies for our immediate need. However, we do have a need to continue to conserve our personal protective equipment as a province and as a health system. We need these supplies for when we see COVID-19 patients in hospital, and this is when the demand will increase significantly. Everyone in our system has a responsibility to each other and their patients to conserve personal protective equipment so it's available when it's needed to protect our staff and patients. The cough and fever clinics are continuing running with drive-through testing now available in Charlottetown and Summerside. Appointments to the cough and fever clinics are through referral from your family doctor or nurse practitioner or through 811. When arriving at the clinics, we do ask that you remain in your vehicle until you're notified otherwise by staff to enter the clinic, and this is to ensure our infection control measures are followed. Patients who need a test for COVID-19 should continue to call 811. We know we had a bit of a longer than anticipated wait time yesterday with some increased numbers, and we are adding resources to help with this so patients will be seen and offered an appointment as soon as possible. I want to thank the staff who are really frontline in our response to these individuals who are worried they have symptoms for COVID-19 and are working diligently to make those appointments available, expand our service capability to have them seen in our assessment clinics, and provide those assessment and testing for islanders. Thank you.
Thank you. For questions?
Yes, hi, my question is for Marion Dowling. I'm wondering, at this point in time, how many people have been moved out of hospital and into long-term care or community care facilities, both public and private?
That's a good question. I don't have the exact numbers for those who have moved. Anyone who has moved from our acute care facilities to long-term care or community care were individuals who are waiting for those spaces to become available. So we've had good support from those facilities and care homes to receive clients from our hospitals. And I don't have that exact number, but they were all individuals waiting. I do know that we have achieved our target for the Queen Elizabeth Hospital and Prince County Hospital beyond the 75% of their current occupancy rate, and both of those facilities are down closer to 60 or below % for their occupancy rate now, which is what has allowed us to create capacity to move patients around within the building, to create other spaces to be prepared to receive patients with COVID-19 who have different types of care needs than what we might generally have available. But that has also been helped by the reduction to essential services and not offering some of those other services where normally patients would be coming into our hospital.
And if I may clarify one thing, will it only... Oh.
Sorry, we just have a long list. So let's go to Nicole Williams, CBC.
Sorry, can we just clarify? Did you say that COVID patients that placing COVID patients will only be at the QEH, or are they also going to be at the Prince County Hospital?
Initially, we are focused on just one facility receiving them and have space at the Queen Elizabeth Hospital. If the demand increases, we will be spreading that to another facility, which will be Prince County Hospital. Right now, we don't have any confirmed cases in hospital, but that's our bed management plan and part of our preparation. So, yes, I was sharing that today, that initially, patients who require hospitalization for COVID-19 care and treatment will be starting at the Queen Elizabeth Hospital.
Thank you. Mike Robar, The Guardian.
Hi, good afternoon. I suppose this question is more for Dr. Morrison. With the upcoming Easter holiday coming, it's traditionally a time when families are getting together. What suggestions might you have for families to address this holiday that means a lot to a lot of people?
I think it's a great question, and I think it's what we've been doing the last number of weeks, trying to think about how we can do things differently, how we can still come together in different ways that are safe and will minimize the risk of getting ill or potentially making someone else ill. So, and I think it may be even useful from your question to put up a few or bring them here tomorrow, some particular tips, I guess, if you will. But it's not to have a big Easter dinner. That is not what we should be doing. We're trying not to come together physically, and I think that will continue to be important, regardless of the importance of a holiday that, as you mentioned, means a lot to different people. But this year, this is a pandemic, and we are all having to think differently and act differently in order to protect all of us. And so that will be the basic principle and messaging around Easter, which really is the same for today.
Thank you.
Rachel Collier, Eastern Graphic.
Hi. Hello.
Rachel Collier, Eastern Graphic.
Hello, Rachel.
Hello?
Hello.
Hi. Oh, okay. So my question is, if at any point we pass our medical care capacity, have ethical questions such as who will receive life support been discussed among healthcare professionals and officials? And what do those conversations look like?
I think, Marion, you can answer.
We have had those discussions, and we actually had some of those discussions when we were dealing with H1N1 a number of years ago. But those are things that we're currently looking at again and revisiting that and putting a plan in place around what that looks at. And we have a clinical and organizational ethics committee which works with the Nova Scotia Health Ethics Network and their ethicists, who will be offering us some guidance and advice around what our plans are for that approach should we need to get there.
Okay, thanks.
Welcome.
Carrie Wynn McLeod, Ocean 100.
Hi, Carrie Wynn.
Hi, Dr. Morrison. My question is, we know, we've heard about, the cough and the fever being, some of the main indicators of COVID-19. As you probably know, there have been a number of articles written around the world and tests happening that are saying some of the earlier onset symptoms could very well be a loss of taste and a loss of smell. Can you comment on that? And has any of the patients here that have been diagnosed with COVID-19 expressed anything like that, or have they even been asked?
Yes, so all the symptoms are important, and we're keeping track of what patients or cases are telling us about their symptoms. So the loss of taste and smell is still a minority, or a small percentage of symptoms, but certainly less than 10%. But it has been noted in I believe at least one of our cases here, so which we thought was interesting because it does, as you mentioned, we see that in the literature, and we actually heard that from at least one of our cases, but certainly not the primary symptoms usually. What's interesting, fever isn't as predominant a symptom in our cases in Canada or here in P.E.I. to date. More chills and cough and that would be also what they're seeing so far in the cases in the country too.
Thank you.
Kevin Bissett, Canadian Press.
Good afternoon, Dr. Morrison. Some prisoners here in the Atlantic region today are expressing concerns that there isn't sufficient social distancing in prisons and in provincial jails, and they're worried about the COVID-19. I'm just wondering if you've had a chance to look at whatever situation is at Sleepy Hollow as far as social distancing and what would happen if there were a positive case there.
So I think that's a very good question. I think I haven't been out to visit the facility there, but my understanding is that they've already put some measures in place in terms of even looking at who is in the jail and who needs to be in the jail, and but I think it's a very good question, and I'll certainly be doing some more follow up in that area as well.
Thank you. Julien Lecacheur, Radio-Canada.
Docteur Morrison, depuis le début du confinement, vous demandez aux insulaires de trouver tout un tas d'activités pour s'occuper, et justement maintenant il y a beaucoup d'initiatives sur les réseaux sociaux. On voit des trivia, on voit des cours de gym, on voit aussi des lectures qui sont faites aux enfants. Quel est votre avis? Qu'est-ce que vous pensez de toutes ces initiatives qui sont faites par les insulaires sur les réseaux sociaux pour garder les insulaires actifs à la maison?
Oh, je suis tellement content que c'est exactement qu'est-ce qu'on veut. On parle de faire des choses un peu d'une façon différente, de voir les personnes qui peut engager les autres, mais sans être au même lieu, tout ensemble physiquement. Alors je pense qu'ils ont beaucoup d'imagination, ils ont de bonnes idées, et puis c'est tellement important pour les enfants d'avoir des activités physiques ou des cours qu'ils peuvent faire les jeux ensemble. Mais les jeux ensemble, mais quand ils peuvent en faire dans leur propre maison. Alors, c'est les choses comme ça que je pense vont faire une différence, même quand on n'est pas dans un pandémie. So, de rien. I was asked what I think about some of the things that we're seeing online with activities for children to do at home, and trivia and games and online. And I think those are great examples of how we're adapting and coming up with ideas and innovation and innovative ways to stay connected even if we're in our own homes.
Laurent Rigaud, La Voix acadienne.
Bonjour, Laurent.
Bonjour, Dr Morrison. J'avais juste une question sur les 3 personnes qui sont considérées comme guéries. Je voulais savoir quel type de soins ou de médicaments elles ont reçus. Est-ce qu'elles ont reçu des médicaments particuliers? Qu'est-ce qu'elles ont pris pour aller mieux?
Alors, le traitement pour les cas qui sont pas tellement sévères, il n'y en a pas vraiment des médicaments. Des fois, ils en prennent juste quelque chose pour la fièvre, ou s'ils font un peu mal à la tête, mais il n'y a pas des médicaments pour guérir. Alors, c'est le temps et vraiment les choses supportives pour les cas qui sont pas sévères, et c'est le cas pour les 3 personnes ici qui sont recouvertes.
François-Pierre Dufault, Radio-Canada.
Bonjour.
Bonjour, Dr Morrison. Pourriez-vous prendre quelques secondes en français pour expliquer un peu ce qui est arrivé avec le transfert des patients en santé mentale à l'hôpital Queen Elizabeth aussi? Pourquoi c'est important de faire de la place pour d'éventuelles hospitalisations à Charlottetown et aussi peut-être à Somerset?
OK. Je vais peut-être répéter la question en anglais pour que Marion peut répondre en anglais, et puis moi, je vais répondre en français après ça, si ça va?
Oui, bien sûr.
The question is about, and you please make sure I have this correctly, but could you speak about the transfer of patients outside from the hospital, sort of from a mental health point of view, if they're being moved from one place to the other? I think est-ce que c'est qu'est-ce que vous voulez demander?
All patients, mental health, and also patients in hospital.
Oui, c'est le transfert des patients.
Yeah, so we've moved a number of people around and services around, and some of the staff have moved as well to provide the capacity at the larger hospital for what we expect or what we anticipate, so that we're prepared for that, which is part of our good planning, I guess, is being prepared. I'm not sure what exactly you'd like to know. The urgent care clinic for psychiatric patients is more of an outpatient type clinic for those individuals to try and make sure that they're not coming to our emergency department mixed with other patients who may begin coming with suspected or some positive COVID patients coming there. But really, we have done moves through to the community hospitals and to our other facilities to kind of create that space. So I'm not sure if I've answered exactly what you're looking for, but...
C'est vraiment que je pense que Health P.E.I. ils sont en train de mettre les patients même à l'hôpital qu'ils attendent pour un lit ou pour le long-term care. Ils se déplacent là, mais c'est les patients qui sont déjà en attente pour ces lits. Et s'il y a des patients qui peuvent être sur les autres régions à l'île, ils vont là parce qu'on veut assez de lits, d'espace pour prendre soin des patients de COVID-19 à l'hôpital ici à Charlottetown. Est-ce que ça répond à ta question?
Oui, merci beaucoup. Thank you very much.
You're welcome. Okay. Thank you very much.